depression. Causes, symptoms, treatment, depression. Depression is a complex and common mental health disorder characterized by persistent feelings of sadness, hopelessness, and a loss of interest or pleasure in daily activities. It can affect a person's thoughts, emotions, and physical well-being. Here is an overview of depression, including its causes, symptoms, and treatment. Causes of depression: biological factors, imbalances in certain neurotransmitters, chemical messengers in the brain, such as serotonin, norepinephrine, and dopamine, can play a role in depression. Genetic factors: there is evidence to suggest that a family history of depression can increase an individual's risk. Environmental factors: stressful life events, such as the loss of a loved one, financial difficulties, or relationship problems, can trigger depression. Childhood trauma or abuse can also be a contributing factor. Medical conditions: certain medical conditions, such as chronic illness, chronic pain, and hormonal imbalances, can be associated with depression. Psychological factors: personality traits, low self-esteem, and a history of anxiety or mood disorders can make a person more vulnerable to depression. Symptoms of depression: persistent sadness, feeling down, hopeless, or empty most of the day. Anhedonia: a loss of interest or pleasure in previously enjoyed activities. Changes in appetite and weight: significant weight loss or gain, along with changes in appetite. Sleep disturbances, insomnia, difficulty falling asleep or staying asleep, or hypersomnia, excessive sleeping. Fatigue: a persistent feeling of tiredness and low energy. Feelings of worthlessness and guilt, frequent thoughts of self-blame, guilt, or worthlessness. Difficulty concentrating, trouble making decisions, and concentrating on tasks. Physical symptoms: unexplained aches and pains. Thoughts of death or suicide, recurrent thoughts of death, dying, or suicidal ideation. Treatment for depression: psychotherapy, also known as talk therapy. Psychotherapy involves working with a trained therapist or counselor to explore and address the underlying causes of depression. Cognitive behavioral therapy, CBT, and interpersonal therapy are commonly used forms of psychotherapy. Medication: antidepressant medications such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, can be prescribed to help regulate neurotransmitter levels in the brain. Lifestyle changes, engaging in regular physical activity, maintaining a balanced diet, getting enough sleep, and reducing stress can have a positive impact on mood. Social support: building a support system of friends and family can provide emotional assistance and encouragement during the recovery process. Mindfulness and relaxation techniques, practices such as mindfulness, meditation, and deep breathing exercises can help individuals manage stress and anxiety.